benefits, I think, coming out of this for families and for family relationships.
You're a pediatrician. You deal with all the little ones, but not just the little ones, right? You also deal with their parents. Just set the stage for us. I mean, what's going on in your world? How are parents reacting to all this? How are kids feeling? What are you experiencing?
Well, I think this is a new way of living for all of us. I mean, parents aren't used to being home 24/7 with their kids. Kids are out of school. Many parents are working from home. Everybody's adjusting to living in one small living space without a break from each other.
Right.
So,
Right.
as a pediatrician, I deal with both the physical health and also the mental health of my families. And it seems that these days I'm working more on the mental health and helping families all get on the same schedule, sit down and communicate with each other, and trying to focus on the positive with my families every day in the office.
And I have loved seeing the pictures of you and your family with your boys. Can you talk to us about what you guys have done? Not to put your family on blast.
Definitely. No, that's perfectly fine. So my boys are actually, I have 2 teenagers and a 5-year-old. So that's been really interesting. And although my teenagers might roll their eyes when I say, hey, we're playing Silly Street or Candyland tonight, it's actually so much fun to get down to that level and get back to your kindergarten self and play some of those games for the younger kids. We've also done a lot of backyard outdoor time. Luckily, we're in Los Angeles where the weather has been great lately. We also have been having these family meetings where we can really, talk about what's going on. And I let my kids voice their opinion. So my 12-year-old made his argument on why he should be able to play video games now on school days, which has never been allowed before in our house. And you know what? I think that's okay, as long as they're also, doing their chores and helping out and getting along with each other and getting their schoolwork done. I'm laxing up on things that I used to be really strict on, right? We're all making compromises these days.
But you know what? I think that people need to actually hear that it's okay to do that. Even my sister-in-law, right? So my sister-in-law sent me a picture of her living room with my brother and my 2 nieces. And, there are toys everywhere. The baby's got half her clothes on, the older one, it's like mayhem. But I think that you as a pediatrician giving us almost permission, and not to rest this solely on you, right? There are a lot of experts saying this, that this is a new normal, and perhaps things need to change in terms of how we've done things. It's okay to be lax in certain areas. It's okay to make adjustments in our schedule. It doesn't have to be, and maybe shouldn't be, exactly what it was like before all of this came along. And I really appreciate you actually talking about that, because I think it puts a lot of parents' maybe minds at ease,
Exactly. And I've had to sit down with many moms and say, it's okay if your house isn't organized and put away every day. We have to let some of that go, because we can't do everything, and all get along. I'm FaceTiming with my families regularly, to help get them through the symptoms, making sure everyone is able to drink fluids, eat okay.
I'm a family doctor and I don't see that many kids. Can you talk about like the pragmatic aspect of a child getting coronavirus and what we do and how we respond?
Definitely. So I have had families who are living through the coronavirus in their household right now. And luckily, all of my patients have been okay. We've had a few grandparents end up in the hospital who luckily have also been okay. The good news is that most young people are doing pretty well with the virus. Now, that doesn't mean that all will. As we see this virus in more age groups, we are going to have all age groups that end up in the hospital and seriously ill. But in most cases with the kids, it's similar to a flu with the high fever, the aches and pains, maybe some stomach issues, the dry cough. When adults get it, it's a little easier because we say, quarantine yourself. Don't share your germs with anyone else in the house.
Right.
And when it's a child, then we also have to choose which adult is going to be quarantined with them, because clearly, a 5-year-old cannot be left on their own. So I usually kind of have the family sort of split up if possible. And I say, okay, choose the one parent that's going to take care of the sick child. And if you can both live in one bedroom with one bathroom in one area of the house, if you're lucky enough to have that space and not touch common areas, that clearly would be best. If the parent is still well and healthy, wearing a mask, any type of mask, if you have it, wearing gloves, washing your hands frequently, and cleaning surfaces is the best to try to avoid the parent, from getting the illness. And then we just try to get them through it without sharing germs with everybody else in the household.
Yeah, it makes a lot of sense. And I love the tips that you're giving, because you're actually telling us practically and tangibly how this would work, and how this does work in many of your households with your patients and their families.
I think, in some ways, a babysitter, a nanny, a caregiver is just an extension of your family.
What's your best guidance for babysitters, caretakers, people coming into the home?
I know that many families need help outside the home, because if the kids aren't going to school and the parents have to go to work, you need somebody there. You need the flexibility. Or maybe you share a babysitter with a few other families and you all can agree on the rules and guidelines. I think you can all work together to really make it safe. And then it's just all about open communication. I mean, when somebody does have symptoms or they get sick, there can't be blame. There can only be like, how can I help you? I'm so sorry you're not feeling well. And let's tell everybody that you've been in contact with, and have everybody that you've been in contact with quarantine and get tested and take the next steps in contact tracing. But we all have to work together, as a community to make this work.
You said if the babysitter or caretaker is, you think of them as kind of your family and they're following the rules that you're following. So maybe that's even a first, like a good initial step for parents to seek out someone that is willing to follow the family protocols, and that they do have this level of trust, which I think is a good piece of guidance for families.
We've sort of laxed our screen time rules in my house because I want them to hang out with their friends, but virtually, not in person.
I know you and I have talked a lot on the news about what's okay and what's not to do during this time, but what would you say to a parent that has a child who is really distraught? Are play dates okay? Could they see a friend one time? Okay. So bring it on. Tell me. So what is a parent to do when they've got that child that's like, come on, mom, I'm just one time. Can't we just go we'll just stay in the basement, I promise. Like, what do you do with that?
Yeah. So, I think this is a time to explain to the kids the true importance of physical social distancing. And we're actually making a difference in areas in this country where we are staying away from others and not having play dates and not going to activities. We're actually seeing a little slowing of the curve. So we know that social distancing really does make a difference. But social distancing is really a physical thing. So you can't see your friend in person. But the one great thing, and we're all learning from our teens, is that they're used to being online virtually and hanging out with friends, right?
That's true.
They text, they FaceTime, they house party. And so sometimes for them, it's not actually a big difference as long as you give them time and encourage them to be, in their room, virtually hanging out with their friends every day. And so, if you look at the family schedule in my house, they get an hour of playtime with their friends virtually. They get an hour of video games with their friends.
Okay.
And these are things that we used to not do on school days. But right now, these aren't normal school days. And I think that is so important. And the most important thing you can do to get along and bond with your kids now is actually connect on things they like to do. And that might be like, hey, show me about this house party app that you use, or show me how you play video games with your friends. I want to do it too. I want to connect with you. And they will actually love that. And this is, again, another great memory that you are going to remember in the future when this is all over.
It's not a perfect system, but it's going to be our way of life for the next year. And I think we have to learn how to work with it.
Let's talk about how we get our kids back to school. What's like a good checklist for parents and kids?
Yeah, I mean, it's a good question. I guess back to school supplies are no longer just going to be, backpacks and pencils and books, right? Everybody's going to need their masks. So if they're washable masks, I would say you need 2 a day, one before lunch, one after lunch, and then you can take them home and wash them at night. And they're also going to need their own hand sanitizer bottle. Middle and high school students are going to need wipes to wipe off their desks and chairs as they move from class to class, hand washing. I mean, I think it's a lot of the same education we've been teaching our kids over the last few months. I mean, I know it seems strange and unusual, and a lot of parents feel like, how is my child going to learn in this environment? But again, they will learn. And if you want your child to go back to school in that environment, I think they will have an amazing experience. And there's also online options as well if that doesn't work for your family. So, there's not a one size fits all approach.
And what about emotionally? Let's talk about that, because I think that is a great checklist. First of all, I like that, the two masks, a spare mask, hand sanitizer, etc. But emotionally, how do we prepare kids?
Yeah, I think it's just talking to them, especially if you've been keeping them home all summer and you've been telling them, don't talk to anyone, don't touch anything, don't, it's kind of saying like, okay, we know a lot more about the virus now than we did back in March when we closed schools. And now we have tools in place to help keep kids safe when they're at school and decrease transmission. So these are the things that, your whole class and your whole school is going to be doing. And it's going to be staying spaced apart. It's going to be making sure that if we don't feel well in the morning, we stay home and we don't go to school. It's going to include lots of hand washing and disinfecting. We're not going to share any items with our friends. And I think it's just slowly teaching them and really being a good role model. As a parent, your kids are always watching you. So whatever they see you doing, they're going to do. So if they see you socializing with friends too close together, then they're not going to really understand that this is something that everybody needs to do. So make sure that you're role modeling the behavior that you want them to do when they're in school.
Really, it's the talking and spending time with your kids and giving them a consistent routine throughout the day that is going to make them feel safe and secure and loved.
I want to talk a little bit about the fear and uncertainty that we are all feeling during this time. I mean, I'm not a child. I'm going to feel as balanced and whole as possible as we go through this uncertain time.
I think that's really one of the most important things that parents need to get a handle on right now and really talk to their kids, because I'm seeing so many more anxious kids and anxious parents, and however the parent is feeling is really going to translate to your kids. So it's really important to take a moment before you sit down and talk to your kids and get a handle on your own feelings. Because if you're running around stressed and yelling and anxious and worried that there's not enough toilet paper or milk, your kids are going to see that, and that's going to worry them too. As a parent, you are your child's best role model. And this is really one of the reasons why I'm encouraging all families to have a family meeting every day. And the most important thing we're going to do is we're all going to check in and talk about everyone's feelings. And it's okay if we're a little worried or we're a little scared, but we can talk about that. We can help alleviate our kids' fears. When this is all over, whether it's a few months, or longer, hopefully sooner, what your kids are going to remember after all of this is not the little things day to day. They're going to remember how they felt. Did they feel safe? Did they feel loved? And they're going to remember the time they spent with you, those board games you played every night, those family breakfasts that you all sat around the table and made and had together. And so this is a time that you're creating family memories. And that's what your kids are going to take away from this and be able to tell their own families about when they talk about this point in history.
Something's got to give, and we don't want the kids' education to be the thing to give.
What are your thoughts about some of the concerns teachers have about going back to school?
So I get it. I mean, teachers, we're asking them to be essential workers, right? Like us pediatricians and nurses, and they don't all feel that this is necessarily what they signed up for, and it can be a little scary. Many of our teachers across the country are also in that high-risk age group. And so I think it's, it's really important for teachers to understand that all the health and safety recommendations that everybody is putting into place for schools are really to help protect them. And so we want to make sure they feel comfortable and they have their masks and their face shields and they can stand 6 feet away from the students and they feel supported. And I think that's also why it's important for teachers to work with the administration when it comes to putting plans in place for their own school. Now that said, some teachers may decide that, for them working remotely and zooming into the classroom or zooming to their students who are remote, is the best situation. But I also want to say that we have a lot of teachers that want to go back, but because their own kids aren't going back to school because they're in a different district or they don't have daycare, they can't go back to teach. So now I have schools trying to be creative and think, can we house the teachers' kids in a different area of the school? So that way those teachers can be there present and teach. And as I always say, there's so many layers involved in all of these decisions, but I think it is important for everyone to work together, the teachers, the administration, the parents, the pediatricians, and the public health officials.